Hello from the Philippines. I am Lucille A. Abraham from the University of Santo Tomas. My topic is ethical standards or issues. Are they relevant to quality patient care? Before I start with the presentation, I would like to say that this study does not reflect the views of the hospital where I hold office, but it has the same views as the university where I study. My research objective is to determine if ethical standards are relevant to quality patient care. In order to proceed, we have to understand the meaning of ethics, which is a part of philosophy that studies the morality of human action. That is, it considers human acts, whether good or bad. In relation to ethics and the healthcare professional, all men and women commonly share the natural moral law which enables them to do good and avoid evil. For this reason, a healthcare professional has to be always in favor of life. In relation to quality patient care, the ethical attitude that is acceptable is to defend life. The point of view of the patient is significant in assessing and improving care, which depend on the interaction with healthcare providers. The sole purpose of the medical profession is not only to provide better health, but also to protect human life. Numerous threats to human life can occur at different stages, particularly the unborn, the sick elderly patient, and in occasions of violence. Human life is sacred from its beginning when it was created by God. Life is essential. A person does not possess it in an absolute way. Life cannot be taken away either by a person or by society. The fundamental principles are the right to life as a fundamental human principle and the respect for the dignity of the human person. The first ethical issue is abortion, which is the termination of pregnancy before the 28th week of gestation, where survival outside the womb is almost impossible. The evidence of life in the various stages of pregnancy has been clearly documented as seen here. Therefore, the right to life of a human being necessarily begins in the unborn child, and human life must be respected and defended totally from conception. The second issue is contraception. The pill and IUD cause the death of babies. When does human life begin? At fertilization, when the sperm penetrates the egg. Do birth control pills and IUD kill the embryo or young human being? Yes. The pill seriously harms women's health. Is the pill safe? No. It leads to breast cancer, stroke, heart attack. However, the natural way of regulating births has no side effects. It is 99% effective. The use of contraceptives harms the family. It causes the downgrade of marriage, more extramarital affairs, premarital sex, fatherless children, single mothers, abortions. Contraceptive use results to greater poverty. It causes the decline of marriage, more crime, social pathology, and thus poverty. But isn't population control connected with economic development? No clear association. Actually, population growth is beneficial. Condom use leads to the spread of AIDS. Will the use of condoms decrease the rate of HIV/AIDS? It will increase it because it makes people take greater sexual risk, thus worsening the spread of AIDS. What's the best solution to the problem? Fidelity and abstinence. While NFP and contraception may have the same goals, the first is non-procreative while the latter is anti-procreative. The third ethical issue is euthanasia. All doctors have in their oath the primordial principle of doing no harm. The WMA has also emphasized physician-assisted suicide is not only unethical but must also be condemned. Any act or omission directed to this goal constitutes murder, a grave offense to the dignity of the person and God Himself. It can be lawful to cease treatment which are very painful or extraordinary. However, the ordinary care of a patient cannot be stopped although death is about to take place. Palliative care is to be highly recommended. The fourth ethical issue is family life. The family is the foremost natural society with rights that belong to it, and it is most important in relation to social life. This is a descriptive study, and the following statistical tools were used in order to determine the relationship between quality patient care as dependent variable and ethical standards or issues as independent variable. The subject and study sites are the 5 Level 3 local government hospitals with the following respondents. The questionnaire was formulated based on the following resources. It was subjected to Cronbach's alpha mean to validate its reliability after pre-testing in 2 government and private hospitals. The survey questionnaire had 2 parts, statements and demographics. A total of 240 respondents were included in the research study, equally distributed among the medical practitioners, nurses, chiefs, and hospital officers. In relation to abortion, the respondents strongly agreed with the score that it is morally not acceptable. The overall statement in relation to contraception is agree. We have observed a slightly lower score in relation to this. As regards euthanasia, the overall remark is strongly agree, as can be seen in the mean and standard deviation. The high score was also reflected in the statements related to sanctity of family life, with an overall remark of strongly agree. Summarily, the respondents replied to strongly agree in statements related to abortion, family life, and euthanasia. There's a slight difference as regards the attitude towards contraception, although this was still in favor of it not being morally acceptable. Abortion is morally not acceptable with overall remark of strongly agree. Human life begins at conception. To seriously threaten that human life is a very grave injustice. If it comes to existence due to a mistake or crime, then the answer is to penalize the perpetrator and not kill the blameless, defenseless human life. If ever the human life is unwanted, then the solution is to give up the baby for adoption. On the statement, contraception is morally not acceptable, the general answer is agree. This is because it is not 100% effective, it has abortifacient effects, can cause injury to the woman, can lead to the breakdown of marriage, and can contribute to the spread of HIV. What is the right component for high economic growth? It is not population control. What are the elements of economic progress? Good leadership, transparency, stable finances, investment, more jobs. Euthanasia is morally not acceptable with overall remark of strongly agree. It is important to emphasize, though, that extraordinary means of care may not be justified when it causes undue burden to the patient and the family, even when survival is unlikely. Ordinary means of care refer to food, water, exercise, and medical care which can be continued. It can be lawful to stop treatment that are painful, harmful, or disproportionate to the anticipated result. As regards to the belief in the holiness of family life, the overall remark is strongly agree. The family is the fundamental unit of society. When it is damaged, it can lead to the breakdown of society. In the same way, a healthy family leads to a strong, progressive society. The following are better solutions to family life issues. Instead of promoting sex education, better implement values education and formation. Instead of distributing contraceptives, provide livelihood programs. Instead of propagating artificial family planning, spend on infrastructure projects to create jobs. Certain healthcare matters do require an ethical approach. Not everything that can be done should be done without any regard of ethical issues. Therefore, to the question, ethical standards or issues, are they relevant to quality patient care? The answer, healthcare professionals cannot be confined only to scientific knowledge and practice, but also to ethical and moral principles which can help guide their decision process and actions in administering quality patient care. This is consistent with the Philippine Constitution. Our belief as a Catholic nation is to protect and uphold life, which is a principle of the Catholic Church. All men and women, regardless of creed, favor life. For the right to life is a fundamental human right. Thank you very much.